Hello, my name is Amy Houtrow, and I use she, her pronouns. I'm a pale white woman, and I have brown hair, brown eyes. I'm wearing black and white glasses, a black and white shirt, black jacket, and the wall behind me is white. I am delighted to be here today to do a brief introduction to health equity as we get ready to discuss the report, A Far Cry from Fair. I'd like to center myself in this work for you. I was born with a very rare genetic condition that was associated with childhood onset disabilities. That means I'm a disabled adult. I'm also a pediatric rehabilitation medicine physician, which means my entire clinical practice is devoted to optimizing the health, functioning, well being, and belonging of children with disabilities. I'm a disability equity researcher and also educator, and am honored to lead the Leadership Education in Neurodevelopmental Disabilities program here at the University of Pittsburgh. It was an incredible delight to work with the FISA team on this project. And just to set the stage for your discussion, I'm going to very briefly give you an overview of health equity and talk about how important it is that we have research in this area to help reduce disparities for people with disabilities. Over the course of my few minutes, you may hear me use person first or identity first language. And for me, both are acceptable, but feel free to use what is most comfortable to you. So, health equity. I'm going to define that using the Robert Wood Johnson definition, which means that everyone has a fair and just opportunity to be as healthy as possible. Everyone. So, if that's our outcome, what's the process of getting there? Well, it basically is breaking down the barriers. And those barriers to good health are broad. There are things like poverty, oppression, and discrimination, and their downstream consequences, such as lack of access to things like good jobs with fair pay, quality education, safe neighborhoods, housing, nutrition, clean water, clean air, public health infrastructure, and of course, a lack of access to health services, which we know are a huge problem for people with disabilities. They face enormous barriers to accessing the care they need and deserve. So, when we reduce disparities or reduce the differences in health from one population compared to another towards optimal health, that is progress towards health equity. And that's the goal. But how do we get to that goal? First, I think it's important that we talk about how health differences are structured in our society. A term often gets used, the social determinants of health, which are basically the conditions in which we are born into. We play, learn, live, love, grow. And those conditions have major influences on our health. I'm going to add a word, which is political. Many of these conditions are amenable to a policy intervention, making them not only social, but also political determinants of health. A quick example is that we know we can reduce child poverty by 50% in 10 years, and that it is a return on investment. Keeping children out of poverty helps us actually do better as a society. It return on our investment is positive. We just need the political will. But we also need the research that speaks from the voices of the people who have been discriminated against or oppressed to tell us about the priorities that need to happen, the changes that need to be made, and best ways we can partner to address them. So we know health is really embedded and built off of these social and political determinants of health. And that means we need to do things at the structural level, how discrimination is just baked in to our society, how ableism, racism, and classism and the like, which often are intersectional in terms of impacting people with disabilities, need to be fundamentally addressed. Also, how systems are designed and operating, which may make it less likely that someone has the opportunity to get what they need. We need to change those systems so that everyone has a fair and just opportunity, so that everyone can thrive in their communities and live their lives as they desire. We also need to know about the intersectional and interpersonal issues that come up. We know and we've heard from folks about how hard it is to work with clinicians, doctors, and other healthcare providers who are disrespectful, disregard people with disabilities. So it's at every level, whether it's one on one, group by group, how things are organized, how things are financed, how things are structured in our society. And so when we think about what needs to happen, it's important to be centering on the voices of the people who are oppressed and make changes to reduce that oppression so that everyone can have a fair and just opportunity to be as healthy as possible. I'm delighted to pass this virtual baton over to my colleague, Dr. Jessica Jarvis. I hope you guys have a fantastic session. Thank you.